Is there anyone here that knows of someone diagnosed with polycystic ovarian syndrome? A close friend, family member, or maybe even a colleague? Polycystic ovarian syndrome, also referred to as PCOS, is an endocrine dysfunction and the number one cause for female infertility worldwide. It affects 1 in every 10 women. Treatment options to date include diet, exercise, and invasive methods such as medications or surgical procedures, which all have associated side effects such as mood swings, nausea, and even infections. There is a need for non invasive treatment. Throughout the past 4 years, my team and I have studied the effect of non invasive EMR during the development of PCOS. To do this, we examined a rat model induced with estradiol valvulae to depict the human condition. These rats were exposed to electromagnetic radiation for 2 months continuously, and the hypothalamus, pituitary, and ovarian axis was examined. But why study the HBO axis? Well, this axis determines the regulation and the release of an egg from the ovary. In PCOS, this egg is not released, and instead it forms a fluid-like sac that causes women to experience abdominal pain, excessive hair growth, changes in their hormones, and even lead to infertility. In our experiments, PCOS rats exposed to electromagnetic radiation showed a slowed and reduced number of follicular cysts in the ovary. We also saw significant changes in the pituitary, but no changes in the hypothalamus. We saw improved hormonal levels such as luteinizing and follicular stimulating hormones, which are usually irregulated in the PCOS model. We further studied post-electromagnetic EMR effects, and the results revealed that cystic development continued in the ovary. Overall, we saw the estrogenic effect on the pituitary and the ovary returned post-irradiation. This non-invasive technique has clearly demonstrated that it can be useful in the treatment of PCOS, but the research is still new and many limitations exist. This work has been published and my thesis has also been submitted, so please feel free to have a read. Currently, my team and I are continuing to investigate this research using other PCOS models, and maybe one day, women diagnosed with polycystic ovarian syndrome worldwide will have a non-invasive technique that will help to improve the overall quality of their life.